Hi, my name's Peyton. This is Jacob.
Hello.
This is Cooper. I'm back home for this weekend, so that's why we're in a little bit of a different setting. And also we got tattoos today, so that's the funny looking bandage on Jacob's shoulder. All right, you ready?
Yeah.
Okay. Can you describe what gum disease is? And gingivitis or periodontitis, if either of those ring a bell, that's what gum disease is.
I know gum disease is caused when you don't brush your teeth.
So kind of like we discussed 2 weeks ago, that plaque and that calculus, that biofilm, essentially, when it goes untreated, undisturbed, it can lead to gum disease. So, gingivitis is the inflammation of the gingiva, and it is reversible. Whereas periodontitis is the progression of gingivitis. It's not reversible, but it is the inflammation of the surrounding tissue structures of the tooth. So this could be characterized by bone loss, ligamentous detachment, and also gum recession. And it could also have systemic problems linked to it. So the first thing I'm going to describe, in order to diagnose gum disease, we have to understand what normal, healthy gums look like. So on page 17 of the chairside manual, I'm going to show you this top left picture here. Notice how pink, light colored, and firm they are. There's no swelling. They're stippled, which means, do you see that roughness?
Yeah.
Kind of looks like an orange peel. We call that stippling. That's important to understand because with gingivitis and periodontitis, we're going to see swelling of the gums, and that stippling will no longer be present. The biggest thing to know about healthy gums is that there's no bleeding. When we're brushing our teeth, when we're flossing, if we're at the dentist office and they're using instruments, there's never any bleeding with healthy gums. And that kind of leads me into my next point here, explaining the significance of bleeding. Bleeding indicates that there's a disease occurring, that is either gingivitis or periodontitis, and that our body has sent immune cells to try to fight off that infection. So, kind of, again, we talked about biofilm a couple weeks ago. When it goes undisturbed and untreated, and it goes subgingivally, our body will naturally want to send an immune response. And to do this, our body is going to make our capillaries, our blood vessels in our gums, leaky and permeable so that they can allow these large, big immune cells to the area to attack these bacteria. However, when our capillaries become leaky, that means we're going to allow extra fluid out, leading to swelling. Like we saw in this gingivitis, there's no more swelling. This really red, unhappy looking gums are really swollen. Swelling's going to lead to ulcerations of the lining of the gum tissue. And these ulcerations are very prone to irritation. So when we're brushing, flossing, going to the dentist, these ulcerations will easily become irritated, leading to bleeding. So really all this is to say that if we see bleeding, we know that it's a sign of disease. So, with these diseases, a characteristic of them, a sign that we can see, is pockets. There's two types of pockets. There's a pseudo pocket or a false pocket caused by gingivitis, the earlier stage of gum disease. And this is caused by the swelling of the gums. So the gum line is actually going to move up towards the crown of our tooth. And these probes, which are instruments that have measurement lines on them in order to read in millimeters, are going to get a large reading because of the swollen gum lines. But there's no tissue loss, there's no deterioration of the bone, nothing like that. Unlike a periodontal pocket, which we see here. Do you see that bone loss here? And then going to page 16, look how far in that probe is able to get. It's because of that bone loss. Periodontal pockets, there are tissue loss leading to that large reading. So they're both large readings, but for different reasons. And to determine that, we might have to use an x-ray to see where the bone line is at. To kind of connect it to you, working in the auto shop, do you ever have to use those tread measurement tools? Yeah. It's kind of like that, except almost vice versa. You want a large measurement to say, hey, this tissue's got a lot of life left. We want smaller measurements. Anything 1 to 3 millimeters is healthy. Anything greater than that, though, is a signifies disease. So, all right, we're going to talk about the bone that holds our teeth. So both our upper and lower jaw has what we call the alveolar process. Within these alveolar processes, we have alveoli, which are these sockets of our teeth. It's kind of like little cups designed to hold that tooth root in place. But a characteristic of periodontitis, like we saw here, is bone loss. And that's mainly because, remember how I said that those immune cells are going to go to the area to attack that disease? Our own body is actually going to accidentally cause collateral damage and cause that bone loss, leading to these lower levels here.
Yeah.
And because of this bone loss, we're going to see a loss of stability. We're going to see a lot of wiggliness of our teeth, and this could actually lead to tooth loss as well. And the treatment for that would then be implants, dentures, basically a really long, expensive road of treatment. So the good news is that both gingivitis and periodontitis are preventable, and there's a few risk factors that contribute to these diseases. First of all, let's also remember periodontitis is the progression of gingivitis. So essentially you get plaque. If that doesn't get removed, you'll have gingivitis because that inflammation. Gingivitis, if that's not maintained and treated, then we're going to have to go to periodontitis. So some factors that lead to these diseases aren't controllable. Our age, our race, our gender. We have no say in that. But there are some factors we can control, such as managing good oral health, maintaining other underlying diseases, the cessation of smoking, establishing good nutrition habits, everything like that. The biggest factor that contributes to these diseases, though, is biofilm, and it's important to brush twice a day to prevent the biofilm accumulation and therefore prevent your chances of obtaining one of these diseases. And with my last 15 seconds, I just want to show you this picture here of these treatments. So to see that really bad gum recession and then how pretty it is afterwards and how much less bleeding there is.
Yeah.
Any questions?
No.
Alrighty. Thank you.